Hello and welcome to the Tinley Chamber Spotlight Show. Happy holidays, viewers. It's hard to believe we're in the month of December. We have a great show in store for you today. But before we get started, I'd like to send a warm thank you to all of our folks here at the CRC studio for helping us have a wonderful year. I'd also like to give a big shout out to the Chamber of Commerce and all of our directors, and more importantly, all of our members. So let's get the show started. I'm here with the owner and founder of Aishling Home Companion Care. Aishling Dalton, welcome to the show.
Thank you for having me.
How are you today?
Great. How are you doing?
Good, good. Ready for the holidays?
No, but I will be.
All right.
I will be.
Well, let's give our viewers a little bit of background about you and about Aishling Home Companion Care.
Okay, so I am the youngest of 10 girls born and raised in Ireland. And my mom suffered from dementia, which is where the whole idea of this business came from, watching everything that unfolded with her. So I opened the business in 2012, and we're 2016 now, heading into 2017, and the business has been very successful, and I love what I do.
Wonderful. So hit home, a family member with dementia.
Yes.
So tell us a little bit about your background and how you really got started here. I know you're in Orland Park and a member here of the Tinley Chamber.
Yes. So how I got involved really was looking at what unfolded with my mom, as I had said, and dementia is incurable. Medicine can help it, slow it down. It can help with the sleeping, it can help with all sorts of issues with dementia. However, it cannot prevent it. So from a daughter that looked at a mom who was medically being taken care of as her daughter and as a family, we looked at her and figured, what can we do for her as a person, as another human being that medicine didn't take care of. And that's where the first love of all of this came for me, was to dig deeper and to find out how you can entertain, support, encourage and redirect a person with any sort of dementia on a daily basis, because there's no manual. There's no manual that can give you any sort of direction. And that's where I started to really dig and delve into what I could do. And that's where Aishling Companion Home Care really digs deep to help people and families that do struggle, because there's no magic manual that can help them figure this out.
Absolutely, and it's ever changing.
Yes.
How big is your facility?
So we are quite big. When I was on the show a couple of years ago, I actually don't really remember how many I had, but it wasn't that many. We have about 60 caregivers now, and we have 6 people full-time in the office that each have a different department to take care of the customer experience, from when a family will come forward and look for our care to where we will go out to the house, write a care plan, and work out the details for the person that we're going to be taking care of, and follow it all the way through, customer service-wise, giving them what they need, and then also giving our caregivers what they need as well.
Wow, so a full assessment.
Yes.
And in-home care. Talking about, we're just about to embark on 2017, and with insurance and this being a big election year, tell us a little bit about, or what someone can expect in the process, because is there coverage?
Well, there isn't, and actually one of the biggest misconceptions for families is that they think that our insurance covers it, and unfortunately it doesn't. It's all private pay, and private pay means that it's coming out of your own savings. There are 2 instances where money will come into play, and that is that if you are a veteran or you are married to a veteran, there are certain benefits that we can put you in the right direction to get. Not a lot of our veterans even know about those benefits, so we try to ask them that in our intake call to see where we can direct them to get those benefits. The only other way that any sort of money kicks in is if you had the savvy, which most of us don't have and didn't have, was to take out a long-term care insurance plan probably 20 or 30 years ago. So I would encourage anybody that's watching today to take one out now, because nobody knows what's in the future. So your medical insurance does not cover it, because we are home care non-medical, and a lot of people confuse that with home health. And we are not home health. Home health would be when you are discharged from a hospital, post-surgery, broken leg, broken arm, something like that, or you are placed in a rehabilitation facility to rehab and then you go home. So that's a completely different entity, and many people get it very confused because home care, home health, they both sound the same.
Sure they do.
Yeah.
Sure, and that's something, I mean, I didn't even realize. So someone that is diagnosed and suffering with dementia without a long-term plan or being a vet,
Right.
they are not covered.
No,
Oh,
they
my
have
goodness.
to pay for it. And, you know, the care is reasonable. It's not expensive. Different companies have different prices. It really all depends as a family, what are you looking for? How many hours do you want, and what type of care? Because there is all different types of care. As I had said earlier, we're non-medical, so our ladies do not have to be nurses, they don't have to be CNAs, they are caregivers, and as such we train them from the very first day, customer service and HIPAA compliancy, to infection control and all sorts of different training that they do on a monthly basis as they take care of clients. So they don't have to have the medical component, but it's very important that they are trained, and they're trained correctly, especially if they're dealing with somebody that's in the second stages of dementia or even going into the end stages, because there's a lot of different things that happen there that we need to have our caregivers trained especially for that.
Wow. And what is it, a typical day like? Is there a certain amount of hours that someone can request as far as?
Well, most people when they call don't know what they need. So we always say, well, why don't you start with the basics? And depending on, again, the diagnosis from the doctor, if a doctor says to you, as the daughter of somebody that has dementia, that your mom cannot be alone, then the basic 12 hours a week are not going to help you because your mom cannot be alone. So our basic coverage is 12 hours a week. It's 4 hours per visit. And you pick whatever days you want us to come. If you need more care, then you can up the hours. We do shift work. We can come in 8 hours at a time. We can do live-in if they need to live in around the clock, or we do continuous care like in a hospital, 3 shifts a day or 2 shifts a day. It's all customized by what your needs are, and what your needs of your family are.
So the assessment is really essential.
Yes.
So that's excellent. Folks, to find out more about Aishling Home Companion Care, you can reach the tinleychamber.org website or call us at 708-532-5700. A lot of great information. We just have a couple minutes left, and let's talk a little bit about your background, because I know that you're involved with, staying involved, first of all, with what you do, but I know you had some accolades that we'd like to share.
Well, we are proud members of the Home Care Association of America, which there are 105 agencies in Illinois that are part of that association. And we really pride ourselves on being an advocate for both the senior and our caregivers by complying with state law, Illinois Department of Labor, and just making sure that both entities are taken care of in the house, customer service wise and best practices wise. I think the biggest and beautiful thing in that association is that if I can't help somebody, I can reach out to another business owner that's in that association that I network with, I know and I trust, and I also understand their best business practices, and we always get the customer taken care of.
That's wonderful. Very good. Well, we just have about a minute left, and I want to thank you for being on the show and wish you happy holidays. If you have a parting message that you would like to share with our audience, please feel free to do so, and we welcome you back very soon.
Well, thank you. I'd just like to say that Christmas is a very special time of year. A lot of families travel from out of town to come in and visit their parents, and they notice things that they didn't maybe notice before. And I would say to you that don't leave anything to the last minute, especially if you do notice changes. We need to take care of your parents before they actually need us and not after they need us. So that would be one little tip that I would give to families coming in for Christmas. Don't be reactive, be proactive.
Very good. Well, thank you again for being on the show. And again, to find out more about Aishling Home Care, you can reach the Tinley Chamber office at 708-532-5700 or visit at tinleychamber.org. Thank you.
Happy holidays.
You too. I'd like to welcome our next guest, Panorea Bakutis, who comes to us from Robert Morris University. Panorea, welcome to the show.
Thank you for having me here on the Tinley Park Chamber Spotlight Show. I'm very happy to be here.
We're excited to have you. So tell us a little bit about your role at Robert Morris and a little bit about what's happening.
Of course. I'm the director of the institutional graduate recruitment for the Morris Graduate School of Management, which is a division of Robert Morris University. And my main office is here at the Orland Park campus, and also in Chicago as well. And my main role is to go out into the community and different colleges to recruit students for our graduate study programs.
That's excellent. So you travel between both locations?
Yes, I travel between both those locations. We have 10 locations throughout the state of Illinois, and also visit other colleges and other community events as well.
Fantastic. So tell us a little bit about what's new and what's changed in
Sure.
going back to school.
Sure. The main focus that I want to bring here today is the extreme importance of having a graduate degree in today's world, in today's economy. Surely it's no secret that what was okay in the past somehow isn't quite cutting it in the present economy, in today's marketplace. For example, it's great to go to school and get a bachelor degree, but nowadays it's like, yeah, okay, so you need that bachelor degree to get your resume looked at, but as far as going out there and landing that more desirable employment opportunity, or to get a promotion in a company where one may presently be working, you definitely need that second higher education degree, that graduate degree.
The landscape has changed and it's definitely more competitive. Very interesting, and let's talk a little bit about some of the programs, the special programs that you offer.
The main focus that we offer really is our MBA, and we, for the third year in a row, Crane's Chicago Business Guide, the MBA Guide, has voted our MBA program as one of the top 5 most competitive in the Chicagoland area. So we're very proud of that accolade. Also, Money Magazine last year, August 2015, voted us as the #1 Value All-Star.
Wow.
As well, yeah.
Wow.
What they did was, the dialogue these last few years has been, is college worth the financial debt? So what Money Magazine did was they traveled throughout the United States and studied, I believe it was like 1,500 colleges, universities, and they compared the tuition that was being paid versus the education received, how invested were the faculty with the students. They looked at the retention rates, graduation rates, meaning were the students actually graduating when they were told they were going to graduate,
Okay,
and
on
not
time.
a year or 2 later. And for that list, we made the top 50.
Fantastic.
We were the only school in Illinois to make it in the top 50. And then they went ahead and ranked us as the #1 Value All-Star. So these are just some of the latest accolades we've received.
That's
Yes.
wonderful. And how long have you been with the organization?
Well, LinkedIn recently congratulated me on my 11th year. So I've been
congrats.
with Robert Morris for 11 years now.
That's wonderful.
Yes.
That's wonderful. As far as flexibility, I've, in my travels, talked to a lot of adults returning back to college and maybe even getting a second degree. And how flexible, what's the schedule like? Is it, can you maintain that full-time job and still earn
Sure.
an additional degree?
Sure, of course. Our school services not only the traditional high school graduate, but also through our adult continuing studies program, we have a very flexible schedule in the evening for adults who are returning back to school to maybe complete that degree they once started, or just they never went to school in the first place and now they know the importance of getting that bachelor degree. And the same thing for the graduate degree, where we do have an evening program to accommodate their employment and their family obligations as well. Another thing I wanted to mention is that for businesses through the Chamber that do offer tuition reimbursement to their employees, we match those dollars.
Wow.
And we multiply them by 2 times to earn a graduate degree and by 3 times to earn a bachelor degree.
That's incredible.
I know. We're the only school that I know of that offers that opportunity and that advantage.
That's an incredible incentive,
Yes.
especially for someone, we know what the challenges are sometimes trying to manage the family and everything else. So
Yes, yes.
that's really exciting. So 11 years with Robert Morris,
Yes.
and has your role changed much? I mean, what have you seen over the 11 years?
It has changed many times. My role keeps changing pretty much from admissions to lead generation and now to graduate recruitment. I believe it put me in the different roles of where the most demand is. And which brings me back to my original point. In today's market, I'm telling you, a graduate degree is heavily recommended, and everybody knows this, and that's why it's growing. There's less bodies, like physically less bodies going into school. So enrollment is down as far as going into college in the first place. But when it comes to going back for that graduate degree, that's where enrollment is rising.
Okay. What are the class sizes? I mean, how?
Very good, thank you. We keep the class sizes very small. It could be up to 20, maybe 25 max.
Okay.
They get that one-on-one attention. I know every school says that, but we really do that. And also, we are accelerated. We offer our programs through quarterly systems, a quarter being 10 weeks long.
Oh, wonderful.
A bachelor degree is earned in 3 years, as opposed to 4 or 5 or 6.
So fast track. Okay.
And then a master's degree may be earned in up to 18 months.
Oh my goodness.
So we're definitely accelerated. And another point of distinction is that we give the schedule to the students. First day of school, everybody throws that course catalog at the students and they're like, okay, figure it out.
Right.
Good luck. Yeah, we don't do that. Their advisor gives them their class schedule at the beginning of every quarter. So I tell my students, you don't have to think, you just get to class, pay attention, and do the work, because college is hard.
Puts them right on track.
Puts them right on track. We do all the legwork for them. Their job is to focus, get to class, ask questions. Of course, we're going to have free tutoring, and be a successful graduate, because anybody can start school. It's graduation that counts. And we're way above the national average when it comes to our people actually graduating.
And there are part-time opportunities as well. You had mentioned fast track, but if someone wants to perhaps work at their own pace, they have the ability to do that as well.
Yes, for the graduate program, part-time is 1 class per quarter.
Okay.
And full-time is 2 classes per quarter.
Okay.
So if one were to go part-time, 1 class per quarter, they would be able to earn their master's degree in about 2.5 years.
Okay. And sometimes the job and the family life balance, that's just perfect. So that's great to know. So excellent. Lots of opportunities. You're really getting out there networking, and we're happy to have you part of the Chamber for 4 years now.
Yes,
so
thank you.
We're thrilled about that. Any last thoughts that you'd like to share with our viewers? I know we just had a short time here to talk, but we have just about a minute left, and if you'd like to share any announcements or anything coming up.
Sure, thank you.
Thank you.
Our class start is coming up, our winter quarter is coming up December 5th. We still have enough time for you to apply for our December 5th class start, even though it's just a few days away. And then the next class start is in May, and then again, February is our spring start, and then we have May and then July. We have several class starts throughout the year.
All right, Panorea, thank you so much for being on our show and sharing your message about Robert Morris University. For our viewers to find out more, you can reach the tinleychamber.org website or simply call us at 708-532-5700. We'd like to wish you a happy December, happy holidays, and a prosperous new year.
Thank you.
I'd like to welcome my next guest, Kelly Burke, who is no stranger to the show or the Chamber of Commerce. Kelly comes to us from Insurance Counts, and Kelly Burke, welcome again to our show.
Yes, thank you for having me.
Happy to have you. This is such an important time of year. We're in the month of December. You have so much information to share with our viewers. It is open enrollment time. So for our viewers that haven't perhaps caught an episode before, tell us a little bit about yourself and what you do.
Sure. So I am a broker, which means I represent multiple carriers. I'm an insurance agent. My specialty is personal lines. So that means I do auto, home, life, health, Medicare, all the personal lines business. Like you said, the big deal right now is open enrollment for healthcare and Medicare.
So let's talk about that, because this is a critical time of year as far as, from the calendar perspective. However, there's, with the election And everything upon us 2017 here, you know, what's new, what's changed? Because I know a lot has changed since last year to this year.
Yes. So let's get right into that then, the changes for 2017. So first of all, carriers have shut their doors. So Land of Lincoln, for instance, is no longer in existence. They closed September 30th, so most people should already know that.
Okay.
Harken Health, United Healthcare, Aetna, and Coventry are no longer offering plans in 2017. So really that leaves us with 3 carriers for 2017. Your big carrier, of course, is Blue Cross Blue Shield. Second is going to be Ambetter, which is a smaller carrier. And then Health Alliance, which is only offering plans in, at least in this area, in Will County.
Okay. So just out of curiosity, why did the other carriers drop out, if you will?
Rates. They can't afford it anymore. I mean, it's unfortunate, but people are going to see some pretty hefty rate increases this year. I mean, they're talking 30 to 70% increase.
Okay.
And I should reiterate, this is only for people with individual policies.
Okay.
So if you have a group plan or an employer-based policy, nothing I'm saying matters to you right now.
Okay. So the 3 carriers that are they in the marketplace, so to speak? Am I using the right language?
Yep.
Okay. And so an individual won't know what their increase is until when?
They should know by now. So those letters went out November 1st.
Okay. Okay. So they've already been informed.
Yes.
And as far as those last-minute stragglers, if you will, what do the dates look like?
So your key dates, so open enrollment goes from November 1st to January 31st.
Okay.
Your sort of key dates is December 15th is the date that you need to enroll for a January 1st effective date. So those people with United Healthcare, Harken, Land of Lincoln, Aetna, and Coventry who are not going to have plans anymore need to enroll by December 15th for a January 1st effective date.
So they really need to
get going, right? Yeah. If you do anything after the 15th, you could still obtain a plan. It just won't take effect until the following month. So say you do it December 16th, it would take effect February 1st.
So it's those important cutoffs. So January 31st really is the cutoff for the year, the calendar year.
Right. So what you need to realize is January 31st, that's it. So you cannot make changes to your plan. You cannot switch carriers. You cannot change your network. You can't even change your deductible. So there's no changes outside of open enrollment.
Okay. So let's talk about these increases. I mean, what's different? Is there anything better or improved? Or, I mean, what can you share with us?
Sure. So Blue Cross Blue Shield has come out with a new plan, and in my opinion, it's to be competitive with Ambetter. Ambetter is a smaller carrier with a smaller network. So Blue Cross Blue Shield is now offering a smaller network with a lower rate. It's helpful, but if you need the network, it's not going to help you.
Okay. Okay, as far as coverage, are there, any significant changes with deductibles or anything because of these?
So max out-of-pocket has increased. So 2016, the maximum out-of-pocket was $6,850. It's now gone up to $7,150.
Okay.
So not huge, but if you're picking a plan and you're anticipating this is how much I'm going to spend for the year, you need to anticipate now it's going to be closer to $7,200.
To budget accordingly.
Right.
Wow. Boy, oh boy. So, 3 plans. I mean, is any other tips that we can share with our viewers? Because this is obviously a critical time.
Sure.
For people to make decisions, and they hopefully make the right decisions for their health care.
So I have a couple tips. One, I would consider plans with a high deductible. If you haven't in the past, definitely look into a high deductible plan. It'll help reduce your premium. Again, you're protected on those plans with your maximum out of pocket. So just anticipate on a bad year, this is the most I would pay.
Okay.
Number 2 was the government is providing assistance. So that assistance is based off of household size, so number of people on your tax return, or that you report on your tax return, and adjusted gross income. So I get a lot of people that are self-employed that don't realize that it's adjusted gross income, which is after your taxes, after your write-offs, I'm sorry.
Yes.
So you may qualify for assistance. Take it. And the third point I would make is just you've got to keep an idea of your network. If there's a doctor that you absolutely love that you have to keep, if there's a hospital that you want to work with, you have to make sure to watch for the network. That's going to save you in price as far as staying with an in-network provider versus an out-of-network provider.
Okay. Great tips here from Kelly at Insurance Counts, Kelly Burke Insurance. To find out more, you can reach the Chamber website at tinleychamber.org or call us at 708-532-5700. Kelly, there's so much to talk about. What's next? I mean, what are some other tips that we could share with our audience? I know, insurance is so important and so essential. That A, signing up on time, B, knowing what plan you need to be in. Is there anything else that you can help share with our audience and our viewers?
Sure, I just think people need to think a little differently. You've got to think of it more as catastrophic coverage, unfortunately. It's not what it used to be, where you looked for those plans with that low copay and you had a low deductible. That does not. It exists, but the premiums are so high now, it's hard to obtain. So I would say to look at it as more as catastrophic coverage. So again, a $30,000 doctor bill is a whole heck of a lot more than your, $6,000 deductible,
yes,
if that makes sense. So kind of some stuff I'm looking at with people is, again, high deductible plans, packaging those with like an accident plan or a critical illness rider,
okay,
which would then pay in the event of an accident or a critical illness. So it would protect them in a, quick catastrophic event. Another thing I'm looking at with people is temporary policies. So they don't meet the minimum essential benefits guidelines set by the government. So you, for instance, you would still be penalized. However, if you don't have pre-existing conditions and you don't need those preventative services, your premium is a fraction of what it is for a basic policy.
That's important, and you touched on pre-existing condition. Is it still true that no matter what pre-existing condition someone has, they are able to buy in the marketplace?
Yes.
Okay.
So that's part of the reason that rates have gone up
skyrocketed.
so much, is because there are no medical questions now. I mean, the only medical question is whether or not you're a tobacco user.
Okay. Well, that's important. I mean, you can see the pros and cons to that. Kelly, wow, we just have about a minute left. We thank you so much for always coming on the show and educating our audience on this very important topic. If you have any parting words, or I know that you are working around the clock at this time of year, for the viewers to reach you, of course, they can reach the tinleychamber.org website.
Sure. The only thing I'm doing a little bit differently this year is I am offering a full insurance review. The reason is it's an opportunity to reduce your rates on your home and auto, which
Excellent.
will unfortunately help pay for your health insurance premiums.
Sure, that multi-line discount, if you will.
Exactly.
Okay, so that's great, and you're well-rounded. You offer all of the insurance. Again, we thank you for being on the show and wish you happy holidays and a very prosperous 2017.
Well, thank you, and thanks again for having me. I appreciate it.
Have a great year. Thank you.